Hi, and welcome to Cenario, your partner in mental wellness. Here on our channel, we share educational, insightful, and science-backed content to help you understand your mental health and take meaningful steps toward a more balanced life. If you're ready to learn, grow, and take control of your wellness journey, let's jump right in.
Today, we're diving into a topic that's not talked about nearly enough: the connection between PTSD and hallucinations. I know it can sound confusing, maybe even a little scary, but really understanding it is the first step. So let's get into it. So let's just start with the big question right up front. Can post-traumatic stress disorder actually cause hallucinations? You know, it's a question a lot of people might be afraid to even ask, but it's so important. And if this is something you're experiencing, I want you to know you are definitely not alone. And the answer, based on a growing body of research, is a pretty clear yes. For some people, particularly those who've been through severe trauma, hallucinations can be a very real part of PTSD. But how? How is that even possible? Let's break that down.
Okay, before we dig into the why, let's just make sure we're all on the same page. We're going to quickly define our two key terms here: post-traumatic stress disorder and hallucinations.
First up, PTSD. So what is it really? It's a condition that can pop up after someone goes through a terrifying event. But it is not, I repeat, not a sign of weakness. It's your brain's natural biological response to an overwhelming amount of stress. It's a survival mechanism that's just trying to protect you.
The symptoms of PTSD usually get grouped into four main buckets. First, you've got intrusive memories, things like vivid flashbacks or nightmares. Second is avoidance, which is when you start steering clear of anything that reminds you of the trauma, which can make your world feel smaller and smaller. Then you have negative changes in your mood, and finally, hyperarousal, that constant exhausting feeling of being on high alert.
Okay, so what about hallucinations? What are we actually talking about? Well, simply put, they're sensory experiences that feel 100% real, but they're being generated entirely by the brain. It's a sight, or a sound, or a smell that isn't physically there.
And these can show up in any of our five senses. We often think of seeing or hearing things, and those, auditory and visual, are the most common in PTSD. But they can also involve smell, touch, or even taste.
All right, so we've got PTSD on one hand and hallucinations on the other. But what's the bridge? How do they actually connect? This is where we get into the really fascinating science of what's happening inside the brain. The key idea here is something called trauma-related intrusions. You see, with PTSD, these hallucinations are rarely random. They're like echoes of the past, deeply connected to the original trauma. Someone might hear the voice of their abuser or see a flash of a car accident. It's the past literally invading the present moment.
So why does that happen? Well, during a traumatic event, the brain sometimes goes into a self-preservation mode called dissociation. It's like a mental escape when a physical one isn't possible. But a side effect is that the memories of what's happening get stored incorrectly, in fragments, little shards of sound, sight, and smell that can then resurface later as these sensory experiences. Trauma can literally rewire your brain. Your amygdala, which is like the brain's alarm system, gets stuck in the on position. The hippocampus, your memory organizer, gets overwhelmed and struggles to file away the event properly. And the prefrontal cortex, your logic center, becomes less active. This combination creates a perfect storm where the brain has a really hard time telling the difference between a memory and what's happening right now.
There's this amazing theory called predictive coding that really helps it all make sense. Your brain is basically a prediction machine. It's constantly guessing what's about to happen based on everything you've ever experienced. But after a trauma, it starts predicting danger everywhere. It's on such high alert for threats that sometimes it actually creates them out of thin air. A shadow in the corner of your eye, a sound that isn't there.
Now this all leads to a really crucial distinction we have to make. It is so important to understand the difference between these trauma-related hallucinations and the kind we associate with psychotic disorders. Getting this right is everything, for getting the right diagnosis, for reducing stigma, and for finding a treatment that actually works.
So yeah, the big question is, how can we tell the difference? If someone is hearing voices, how do we know if it's a symptom of trauma or a symptom of something else entirely?
This table lays it out pretty clearly. With PTSD, the content of the hallucination is almost always directly linked to the trauma. In psychosis, it can be totally unrelated or even bizarre. Also, a person with PTSD might have some awareness that what they're experiencing is a memory, while in psychosis, it could be part of a much larger, complex delusion. And, maybe most importantly, this all points to very different paths for treatment. And that brings us to the most important part of this whole conversation, hope and healing. Because once we understand that these experiences are a part of PTSD, it opens the door to effective treatments that actually get to the root of the problem.
And here is the absolute key takeaway. While medication can have its place, the single most effective treatment for trauma-related hallucinations is not a pill. It's therapy that directly addresses the underlying trauma itself. And there is some incredibly powerful evidence-based therapies out there. Cognitive behavioral therapy, or CBT, helps you change harmful thought patterns. There's EMDR, which uses things like eye movements to help your brain reprocess traumatic memories so they're not so vivid. And prolonged exposure therapy helps you safely confront those memories in a controlled way, so they lose their power over you. Now, that's not to say medication has no role. It can be super helpful. SSRIs, for example, can really help manage the anxiety and depression that so often go along with PTSD. But it's important to see medication as a tool to support the real work that's being done in therapy, not as a replacement for it. So, if any of this is resonating with you, what can you actually do? Well, the first and most important step is to get a professional evaluation, to get an accurate diagnosis. From there, little things can make a huge difference. Keeping a journal to track your triggers, practicing grounding techniques to pull yourself back to the present, and just taking care of your physical health. All of these things can help as you search for a good trauma-informed therapist.
Let's just end on this thought. When we understand that the brain isn't broken, but is actually trying its best to heal from an overwhelming experience, well, it changes everything. The focus shifts from just trying to manage symptoms to actually healing the original wound. And it lets us approach ourselves and others with so much more compassion.
Thank you for watching Cenario. If this video helped you, don't forget to like, subscribe, and share. For personalized mental wellness supplements, visit Cenario.com. See you in the next one.